Okay, I think we're good to go. I want to be mindful of everyone's time. I think everybody saw the notice on the screen. We're going to record today's session just to let everybody know. Welcome. Thank you for coming. We're glad to see all of you here and interested in employer-sponsored health centers, how things are working and how we set it up and the advantages that they can have for you. The front screen that you're looking here is the employer-sponsored health center that is set up, Summit Employers Health Center in the city of South Burlington. A beautiful, lively little office right near the town center, City Hall. Stace, if you can flip to the agenda. And before I walk through, I'm going to ask each of you for a little bit of help and fill out a survey real quick to give us some guidance for the walkthrough that we're going to do today and the panel that we'll have a little bit later. So you throw up that survey, Stacy. All right. Fantastic. I think we're good. So the question, what's interesting people today, and the member experience and return on investment and savings are the keys. But we did get access to get interest in all of the issues. So we are going to hit all of them. Thank you very much. That'll help us as we go. My name is Steve May. I'm with Hickok and Boardman. I'm a benefits consultant. I'm going to be the MC, the moderator for today. We are lucky enough to have Christina carve out some time. She's a family nurse practitioner at the health center, and she'll be walking through kind of the day in the life and how things work and differences from normal physician setting to what we're doing now with our employer health center setup. Barry is going to explain his experiences as a member and his access to the health center. Corley and Kevin will talk about being an employer and setting it up, being involved from the beginning. What were the hurdles to get started? How did it get started? What are the benefits? How are things currently running? And Michael will walk through some of the specific data that we're now currently seeing once this is up and running, pointing to the advantages of the health center. As we walk through, my role will be to talk a little bit about the healthcare environment here in Vermont, and then roll into some of the health center before I kick it off to Christine. So we switch the page, that'd be great. I think we've seen this slide before. Many of you may have seen this slide. We often refer to this slide in the industry and in our market specific. One of the frustrations that we have, and one of the reasons we continue to look outside the standard practice of buying health insurance from an insurance company, is these costs are outstripping inflation, they're outstripping pay increases, and in Vermont, the cost of insurance is even higher than the standard average. Every year, we're fighting increases and trying to figure out how to build a better mousetrap. Having a near-site clinic is one of those ways, is one of those better mousetraps that gives us more control over our claims cost and helps us to get out of this pattern of these large increases every year at renewal time. If you could flip the slide. VT Digger and their announcements, 2020, I think everybody experienced their rate increases. You can see we were double-digit increases for Blue Cross and MVP. 21, those expected increases reduced a little bit. I think we did have some effects and positive effects of downturn in utilization due to COVID, but the news for 22, and these numbers are preliminary right now, but this is double or triple the numbers for 21. So again, this cycle of trying to fight proposed large increases from the insurance companies. And the problem that most of us have, and our market in Vermont is unique in that we're mid-size employers or small employers. So the leverage that we have to argue or negotiate against these proposed rate increases is minimized because of our size. We're not 4,000 life employer groups. This isn't a bunch of large employers in New York City, adding to the frustration that we have to take it, is what the feeling is. And again, we're here to talk about, we don't necessarily have to take it. We can change what this is, and we can bend the cost curve, and we can control our claims cost better by doing things different, thinking outside of the box, and at the same time, providing a great additional experience and benefit for your employees. Shift the page. So the funding arrangement is how you purchase your benefits. Fully insured, you pay a premium to the insurance company, they pay all your claims. At the end of the year, you have how did those claims match up against your premium, and then you have your renewal. A self-insured arrangement is you are responsible for the claims, you open a bank account, all your claims roll through that, you take the risk. The cost of a benefit of that funding arrangement is lower. You pay an admin fee, and you pay Blue Cross MVP Cigna to be a third-party administrator of your benefits. So they supply the network and they do all the negotiating underneath it, but you take more risk, which lowers the cost, and that can have benefits and cost advantages. It gives you more control over your plan and your plan design. And so what we're tracking here in our most recent survey is, of the employers that responded to the survey, what is your funding arrangement? In the recent survey, we saw 29% were fully insured. In our 2018 survey, it was almost half of the employers that responded were fully insured. In a market like ours, like I said, where we're mid-sized to small accounts, fully insured is typically the way to go. As we have had success in the market speaking with our clients, clients are exploring ways to control costs better. As I said, self-insured programs could give you more control. You take risk, but you can control your dollars a little bit better. People are starting to move that way towards self-funded programs. And we have as many as 27% in self-funded. Blue Edge is typically Blue Cross's way to get into self-funding for smaller groups. Captives go another level where you're getting some protections of insurance and being self-insured. So you can see that these employers are moving away from the fully insured world where it's accept the premium increase, pay large monthly premiums, and just have renewal discussions and arguments at the end of the year. So flip the slide. Average rate increases for all plans, despite your funding arrangement. In 18, the average was 7%, 19, 6%, 20, 6%, relatively flat for the averages, but you can see how the highest, those that had bad claims experience, had increases that were insurmountable. There's a wide range there. And again, arguing for your renewals in a fully insured arrangement, while you've got a 33% rate increase in place, is very difficult for your budget and very difficult to negotiate against when you're up against the insurance company. Next slide. So here's where we see how rate increases in your annual renewal position changes if you are a fully insured plan or a self-insured plan. Self-insured plans are roughly half, on average, rate increase of those of a fully insured. Included in fully insured are things that you can't control and aren't part of your budget. Claims risk, insurance risk, claims fluctuation margin, premium taxes. Those are all costs that are built in that no matter how you negotiate, they're there to some certain extent, adding to the cost. If you're self-insured, you can budget for those. You have control over that part of your budget. Premium taxes are not part of a self-insured world, and you have more control over the cost based on your risk tolerances and where you want to go. So that's why we're seeing more people move from a fully insured program to a self-insured program. But all of this stems from that first slide where we're trying to control our costs better and move towards something different than what we're used to in seeing all these huge increases in premium renewals. Flip the slide. This was very interesting to see and appropriate for our discussion today. This is specific to on-site and near-site clinics and the discussion in the market and starting to look outside of the box and what can we do to change it. So we have funding arrangement, but we're still purchasing the same insurance, just in a different manner. We are controlling costs because the employer, are taking more risk. Taking more risk may not be acceptable. We're not really getting out from under the insurance company or the insurance industry or the health benefits environment of these increases coming each year. Trend underneath this is expected to be 7 to 8% every year. If we don't do something different, funding is one piece of it, but if we don't do something different, you're still going to have those increases on your claims base. So taking a look at something like a health clinic is something that can help to control cost in a different manner. And in 2019, you can see 54% of the groups were not even considering this discussion. We're in 2020, that's 41%, but we've jumped from 9% specifically looking at a health center to 22% as part of their discussion. The health center is something that can help, and I've mentioned a couple of times, to control cost. For those of you that haven't heard the discussion on the health center or this is new, just very briefly, the way that this works is Christina, the family practitioner, is a salaried employer of the health center, an employee of the health center. The health center operates for the member groups that join as an administrative expense addition to the health benefits. You don't pay claims through your premium. You don't pay claims through your self-insured bank account. The cost for anything that runs through the health center is covered by a per employee per month admin expense. This is advantageous in a self-insured world because there's less claims that are running against your bank account. That change in risk automatically applies to you. For everyone that uses the clinic, the cost is lower. It's just the admin expense. It's not $150 for an office visit or $250 for some kind of specialty that's done within the office visit. In the fully insured world, that risk isn't absolutely direct from your bank account and how claims are paid, but it is less claims applied to your premium at the end. So your plan will look like it's running better. Your rate increase would be lower. You pay an admin expense, and no matter how many people or how many visits run through the health center, you only end up paying that admin expense for the year. Specifically, one of the advantages, let's say somebody has strep throat. They can use the health center to come in and have that checked out and get the right prescription to cover that, instead of going to the urgent care emergency room or even going to their PCP where they would have all of that checked out. The cost for that would be, in an emergency room, that might be $800. At an urgent care, that might be $220. In an office visit, that might be $85. In the health center, it's an admin fee in the $50 range that helps on a monthly basis. We could have 1,000 people go 100 times and you're still paying that admin fee. It's not driven as much by the experience. So it does help to control the cost. it does help bring the cost down as your employees become comfortable with the health center and moving to utilize the services. Along with the access being great and all the things that you're going to hear from Christina and Barry about the experience, and from Coralie and Kevin about how their employees are operating. It's a great service, and it opens access to people along with helping to control your cost. What I'd like to do before I introduce Christina is, I think this is the last slide before that. Is that right, Stacy? If you can roll the video. So we showed you a picture when we started of our wonderful health center. We have a little video that will run to give you an idea of what this is. The health center is up and running. It has been. We started talking about the health center and putting this together with employers in the South Burlington region in the fall of 2018. Is that playing? Can you hit play on that? We do have 4 member groups. South Burlington, H&B is a member, VSAC and TwinCraft are involved with the center. Again, it took quite a while to talk about what this was and get people comfortable in 2018, but effective July 2020, we phased in different groups to have the health center up and running, and it is fully functional now. And as I said, as Christine steps in to start speaking about her role, where she came from, how that's different than where she is now, you can continue to see what our wonderful little health center looks like currently. So Christina, thank you for joining us and taking time out of your day. I know we have limited time because you do have visits. So thank you.
Well, thank you for inviting me. Do you just want me to start with just a brief overview of the questions Barry sent to me?
Yeah, sure. Use that as how to walk through and your skeleton for it. It might be good to do a little introduction. Have you been out in a normal doctor's setting first and then come here, and how's that different? Would be great to start.
Awesome. So I actually started my career as a registered nurse in the emergency room. I spent 11 years there. And then went back to school to become a family nurse practitioner. I did 2 years of primary care in a small, small rural office, and then transitioned back into the urgent care at the hospital that I had previously worked in the ER. And so I've been doing urgent care for the last 5 or 6 years, maybe more, before coming here. And so that actually brought me into this role with a few more sets of skills than some of the family practice nurse practitioners come in with. So when we first opened, we worked on that. We worked on getting sort of things in place so that I could do some more procedures here in the office, like stitches and small skin lesion removals and things like that. Because those things in an office and in an urgent care cost, tremendous amount in claims. And so, like you said, it's that one-time administrative fee, and so there's no cost to the patient and no claims going to the insurance. I would say the biggest difference for that I feel like in this approach is that the whole focus of what we're doing is to prevent disease, promote health, rather than waiting for the building to be burning and trying to put it out. And in that, as we're doing screenings, we are finding people with some health problems, from pretty serious health conditions. But then that's early detection and getting them set up with the right places and the right connections that they need. But the approach is definitely more preventative and health focused. And in doing so, it also allows me to spend the time that I need to spend with the patients to truly make change, to really help them make that lifestyle change that, most people are just struggling with. They might go on a diet for a couple of months, lose the weight, gain twice back. They might quit smoking for 2-3 years, go through something, and then start back up. So the whole idea is, yeah.
And Christina, you mentioned the time that you spend. Stacy, can you throw up that survey question that we have about how much time do you think, how long do you spend with your doctor during a visit? So we'll have people answer, and then I'll have you give some insight to what your normal visit looks like with one of your members that comes in. So yeah, 77% say 11 to 20 minutes. We have one at 20 to 30 minutes, 0 to 10. So Christina, why don't you, Barry's going to talk about his experience, but when he walks in, how much time are you spending with Barry?
I am, depending on what the patient is here for, I'm spending 30 to 60 minutes face-to-face with patients.
Fantastic.
Certainly there are shorter ones. And one of the things that I do with patients, especially folks that I'm health coaching, is we sort of talk up front about, I have the time available for you if you want to go past the 30-minute slot you're scheduled for. But if you have to end in 30 minutes, tell me you have to end and we'll end. So, at this point, I still have quite a bit of flexibility. And our appointments are designed to give me enough time to get into those little nitty-gritty things that affect our behaviors, that affect our health. And so for let's say an acute care visit, you've got a new spot on your leg, and you're sort of wondering, could it be cancer? Should I get it looked at? I would probably set aside about 30 minutes for that. And, most folks, when they come to the health center, their first appointment is actually with Angela, who's our medical assistant. They get a fasting finger stick that looks at their blood sugar and their glucose and their cholesterol. We have a biometric scale. So we look at not just weight, but muscle mass and, body fat percentage. And they get sort of a big picture of where are you at right now in your health. And I spend maybe 10 minutes with them at that appointment, because that appointment's really just with Angela. But I come out and go over things just so they're not going home wondering about those numbers. Like, oh, this paper says I'm abnormal. And so we spend a little time on that. And then they spend 45 minutes with me doing a comprehensive health review. We go through all of those biometrics. We talk about, do they have a primary care doctor? When's the last time they had a physical? Are they up to date on all the recommendations from the U.S. Preventative Task Force for, cancer screenings and heart disease screenings? And then we go from there. So we set up from that appointment, if they need a physical, we do a physical. If they need, if we identify that they have high cholesterol and they're interested in learning how to eat differently or how to exercise, we set up health coaching. And we're pretty flexible with health coaching. It's very exciting. I have a few folks who fitting exercise into their day was difficult. And so it was sort of daunting for them to want to health coach with me, as well as, I also need to exercise. So I have a group of folks that I have walked with. So we spend the 30 to 45 minutes walking outside in the community while we're health coaching, talking about, what's working, what's not working. And it's a much different approach. And never in my 50 minutes or my hour with a patient do I have to think about how I'm going to code that visit to meet the requirements of the organization, right? So I came from a UVM facility where you could bill higher. Somebody could come in for a strep throat and you could spend 3.5 minutes with them, but you could bill the highest fee as long as you ask them, do you smoke? Do you have any past medical history? What are your allergies? And maybe one question about their family history, but why would you even ask that with strep throat? But if you did it, you could bill higher, and that was the encouragement. That's the push in an organization like that. Where here it's really just about the patient and the patient's experience and then promoting health, making them better. making them feel better, and preventing disease. And that makes them a more, really overall, it has the potential to make them more productive, right? So we all want to feel productive and feel like we're contributing to society. And, and most of the time that is through our job. But you got to be well enough to do your job. So we've had lots of successes. I know that's one of the things that Barry put on here is, some of the successes we've had. And I have many patients that are doing really great things. And some of so when we opened it last July, Angela and I did our biometrics on ourselves. And we went through the marathon, the marathon way, and we did we health coached ourselves is what we did. And I said, oh my goodness, I can't go into health coaching with a BMI of 33. I can't go into health coaching with my cholesterol at 250. Like I have to do something too. So I started with a group of about 5 patients. We all supported each other. I was health coaching them, but they often gave me good, like, oh, hey, you know what I found at Costco? And, so we shared recipes and we walked together. And so far, everyone has lost over 25 to 40 pounds. And I have one person who has done this multiple times with their with a nutritionist, a primary care doctor, a personal trainer. We're talking about somebody who's, morbidly obese. And he said, we talked about what happens, why do you always go back to your old ways? And he said, I get to that 50-pound mark and they say, you're doing such a great job, keep going. And I don't see him again for a year. Next physical, I see the doctor a year later or 2 years later. And in that time, all those sort of old behaviors and lifestyle, the lifestyle change hadn't been made. It was just a diet. And so we're about 10 or 11 months in, and he's hit that 50-pound mark and he's hit a slump. And, this is where he's normally abandoned, but he's not. He's coming in every week for an hour and we go back over, and we're getting down to those things that are really in the under layers that are causing the eating and causing the lack of exercise or contributing to them. So it's just such a different approach. And
so you're seeing this patient once every week
for an hour.
And they're coming in and helping with the health coaching and those kind of things. And again, this is not $150 office visit every single week. This is the admin fee to run the system.
Right. And, since he sees me so frequently, and because of course, we're looking at, some significant obesity, there's some health risks that come with that. Sometimes there's some sores that form on the leg, he's not having to go to urgent care for that. He's already here. I'm already looking at it. I'm already doing those things, and we have rapid strep, rapid flu, with pregnancy tests, we can do urinalysis. And I am seeing anybody who technically could have COVID, I'm seeing in their cars. So I'm getting into protective gear and I'll go do the strep at their car. But most people, it's pretty convenient for them. They drive up, I go out, check their throat, come in.
That's how you did it. I needed that last minute COVID test before I flew to Dominican Republic, and you came out to the truck.
Yeah.
And, I couldn't find a place to do it anywhere else. So that was fantastic.
Yeah. So, I think that that's just that convenience and so far we've had great success. People have been very happy. We've had a few people that were unhappy with the information the scale gave them, but that's not my fault. So, we talked through that. I don't like what the scale told me either.
We've mentioned, we mentioned, and you have brought up normal checkups, strep throat, some quick hit stuff with testing. But in your discussion of the person that's there for their well visits and they're bettering their health, you mentioned that there have been things like sores. I'm sure you're dealing with diabetes or something with that kind of story. This is not just I'm sick and I'm go to the clinic or I need these kind of tests. You're able to deal with and you're equipped and and have the credentials to deal with things well beyond just a health visit.
Correct. We do work with those folks who have multiple. So folks with real significant chronic conditions, they've already got diabetes, they already have heart disease, high blood pressure, high cholesterol. We really want them to stay with their primary care doctors who have seen them for that long amount of time. That's important. That's where they get their connections to their specialists and things like that. But then what we do is we have them sign a release, and I work directly with their primary care doctor, because what we're finding is I would say probably 85% of the people who come in here who are on medications for high cholesterol or high blood pressure have never had a conversation with their doctor about how their diet is affecting their blood pressure. And I'll say, so when you started this medicine, you're now on 3 blood pressure medicines. That's a lot of medicine. And has your doctor talked to you about how much salt you eat? And they go, no, actually, they never mentioned that salt is part of this. And it's so quick to say, listen, log your food for 2 weeks, come back and see me. Let's look at your sodium and let's make a change. And, we've got people down to 1 med. You got people that their goal is to get off their meds, and we're very close. So it's just amazing.
Yeah, that's fantastic.
Getting,
Unfortunately, you have visits today. I want to be mindful of your time. I could hear stories of the extra stuff that you're doing for the next 20 minutes, but I think then you would be late, and
yeah.
We do want to move through here. The next person we're going to introduce is Barry Blixt, and he is going to talk about being a member and actually the experience he's had in the clinic with you. So thank you very much, Christina, for your time. And Barry, go ahead.
Yeah, I just want to thank Christina if she can still hear me, and thanks, Steve. But I can attest to everything she's speaking about, having been to the clinic on multiple occasions. As Steve mentioned, I work at H&B. We're one of the 4 organizations that have access to the clinic, us and our dependents. You can set it up however you want, but I happen to have access. And I was just super curious, to be honest, when it opened last July. And I signed up for, you log into this member portal. I got a login sent to me from H&B, and I logged into Marathon Health, and I was able to pick a date to come in, and there was a drop-down menu of things that I wanted to do. I could be a physical, it could just be an office visit to talk. It could be the biometric screenings that she just discussed, Christina. And I chose the biometric screenings. I'm like, all right, let's set a baseline for myself, right? So I went in there, I did the finger prick, and like she said, that particular appointment was with Angela, who sits at the front desk, super nice and bubbly, amazing person. And we ended up chatting for a half hour. She pricked my finger, and I talked to Christina and met her briefly. But I made that appointment on like a Wednesday, and I was in there on a Friday. And just to give a little insight as to why I think that's great is when I moved here 4 years ago, I was in New Hampshire, then Boston, and then Vermont. And I had a really tough time finding a primary care physician up here. It took me like 3 months to find one that was accepting new patients in Colchester. And then it took another 6 months to get in for my first appointment. So that's a little frustrating being new here, wanting to get a doctor and so forth. So access was great. I got in there super quick. A week or 2 later, when my results came in, I went back, and I will say that my results weren't as great as I would have hoped. I had some high readings on a few different things, and I actually have an appointment to go back in now to check my readings, because I had to make a couple of changes, right? But I was curious and wanted to check it out. That second meeting with Christina was supposed to be probably half hour, 45. I was in there for an hour and 20. We ended up just getting to know each other, talking, getting to know each other on a personal level, which was really nice. Having had so many doctors in different states, I think they were all kind of on par with one another. You get a 10-minute visit, and then, a $150 bill, and that was it. The nurse did most of the work. She would take my vitals, check my weight and all that stuff. And then you just talk to the doctor. Yes, how you doing? And that was kind of it. But it's a much different experience in there, which is really nice. And I've got one other story that's kind of anecdotal that I think is just from a monetary perspective has helped me. I am required by law to go into my doctor, not just for physicals, but also quarterly to get one of my prescriptions filled. This particular medication requires that I go in every 3 months. And it's an office visit. And back to what Christina's saying, they code it as an office visit, and it's billed $150. I was going in for 10 minutes. They check your blood pressure, check your weight, very basic stuff. And it is what it is. I was used to it. COVID hit, and I was now doing those virtually. And now that 10-minute visit went to 3 minutes. It was on a Zoom call. Hey, Barry, how you doing? Good. Barry, you still exercising? Yes. How you feeling? You sleeping well? Yep. All right, great. And that was it. 3 minutes. And then I get a $150 bill, at which point I was starting to get frustrated as a member and a patient. So I reached out to Christina and asked her if she would write my scripts for me. And you had to check with my doctor, and she had to, make sure that was okay and all these things. And I still have to do my quarterly visits, but now instead of paying $150 every time, which was $600 a year coming out of my health savings account, I'm on a high deductible health plan. So I pay out of pocket until I hit my deductible. I'm paying out of pocket for that. And that's not even filling the script. That's just getting it written. Now I'm saving that $600 every year because it costs me nothing to go see Christina for 20 minutes, catch up, have her check everything out, and then she'll give me my 3 months of scripts. So again, I know it's anecdotal, but it's been a really positive experience for me. And for any of you out there, different organizations who are interested in joining Summit Employers Health Center in South Burlington, or maybe you're outside Chittenden County and you want to replicate this model elsewhere, I really recommend pursuing it. And I think it's a great value add for your employees.
Thanks, Barry. That was fantastic. So South Burlington was one of the employers that was frustrated. Those first set of slides that I showed and the continued renewal increases and the old system and the way it was. And they were step forward and were a big catalyst in helping to push this health center across the line. We have both Kevin Dorn and Coralie Home to talk to us about their experience. And what I heard in that discussion from Christina was we could add one of the frustrations which comes out from her insight in how healthcare is run. We have to realize these doctors are running a business. They also are trying to maximize their revenue. So they ask you, do you smoke? It allows them to upcode or charge more for the office visit. Christine is asking you about if you smoke or do these things because she's generally interested in your welfare and trying to help you in your health going forward. So I will turn this over to Kevin to talk about your experience and how you came to this and where your hurdles were and what were the victories and all the fun stuff to talk about as we went into this.
Great, Steve. Thanks. And thanks everybody for attending today. I thought Barry did a great job of talking about an individual experience. Many of my employees have had the same experience. I myself have gone in for the biomedical testing and weight loss and so on, and it's been successful. I also want to go back to the early words that Steve had about the frustration we all as employers are having with the inevitably rising costs of healthcare. Back in the 90s, I think, or maybe the 80s, there was a movie called Network, and the famous line from Network is, "I'm mad as hell and I'm not going to take it anymore." That's how we got, after years and years of working with a dedicated broker, trying to work with the insurance companies to hold our annual increases to as low a level as we possibly could. And he did a fantastic job for us, but it is inevitable. And I came to the realization that the insurance companies who you're paying for these services, for covering claims, are not doing anything to hold costs down. The insurance companies, I believe, are working hand in glove with the major providers to maintain their margin. because they're a business, they have to maintain a margin in order to stay in business. And they say they're doing that for you so that you can have insurance. But at the end of the day, you have no control over. And I just got to the point, and all here in South Burlington, passing these costs on the taxpayers, along with the rising costs for paving and plowing and recreation, all the other things that we do for our employees or our residents. I couldn't continue to just sit by and watch the insurance companies and the providers take a bigger and bigger and bigger bite out of our taxpayers. And so that's when we started to think about, can we go about reducing the cost and capturing the savings from those reductions in the form of a captive insurance provider? So we took both steps. With the help of H&B, we formed a captive, or we didn't form a captive, we joined a captive. And the second part of that was to set up a clinic for our employees. I'll have to tell you that we got into this for cost savings reasons, but we have evolved over time. For me, as an employer, this has become more about the health of my employees. And we're not talking about workers' comp here. We're talking about the normal healthcare costs that are covered under healthcare programs. Of course, we do everything we can to keep our employees safe on a workers' comp side. We've been very successful in driving our MOD down, but that's a different thing. This is about the people who you sit by in the office, or in my case, who are driving our plow trucks or out in police cruisers or ambulance teams or providing library services. This is about their health. And as an employer and as a friend to the 170 plus people who work here in South Burlington, I felt it was important for us to take a leadership position to improve their health. And now the savings and all has become kind of a secondary thing for me. We're achieving those savings. Michael will show you data. Barry talked about the just the value of having time with the provider rather than feeling rushed. Our employees are giving that feedback back to me. I'm sorry, somebody wants to reach me. Employers are giving, or my employees are giving this feedback back to me about going in and spending time with Christina, and it's quality time. We now have mental health counseling as part of the offering. And as we all know, mental health issues in society generally, and certainly among our employees, are on the rise, particularly as we all work together to try to remove the stigma of mental health issues that exist in our society. So I couldn't be happier about how this has come about. I will tell you that we had to go out on a limb, in a sense, and take some risk. Initially, we were by ourselves and setting up the clinic, but we felt so strongly about doing this that we were willing to take that risk. And we are absolutely thrilled that our good friends at VZAC, Hickok and Boardman, and Twincraft have joined with us as well. We are looking for one other good-sized company to join in our practice. My hope is that we get that employer, but more long-term, that other employers band together in the same way, and we can form a network of clinics in the region for which we can all become affiliated, and where locations become more convenient for a broader number of people. I think we will all improve the health of our employees. I think we'll all achieve savings for our business or for our taxpayers, whatever the case may be. This is a model that works, and it's just something we have to do, because I personally don't see the symbiotic relationship between the major providers and the health insurers changing. And as much as I would have hoped 10 years ago or 8 years ago that the Green Mountain Care Board would take a greater role in holding down costs, you're not seeing that. And that's a disappointment. So we can either sit back and just watch the money bleed out the door and watch no real good practical proactive steps to help our employees gain better health in their lives and better quality of life, or we can do something about it. We've started this program. It works. I highly encourage you all to take a solid look at this. The brains behind this whole thing and the woman who made this really happen for us is Coralie Holm. And she knows much more about the detail of the setup and all. I lastly, before I turn it over, Steve, if I may, want to recognize Marathon. Marathon is Christina's actual employer. They manage the clinic. So we're not managing it. Christina has physicians who are accessible to her and specialists through the Marathon network of over 110 clinics nationwide. They're a Winooski company. They're local people who know us. I can't say enough about their management of our clinic. So with that, I would turn it over to Coralie. Thank you all for attending.
Thanks, Kevin, and feel free to chime in if I miss something or you think of something else. But also, thank you everybody for being here. We are so excited about our health center. I can't even tell you how exciting it is to have that resource near our campus. So a lot of bigger organizations outside of Vermont might have a health center on site. And since we're a small state with smaller sized employers, where you might need 750,000 employees to have a health center to make it financially viable, we had to come up here with a partnership model, and it has worked very well thus far. And so I'll share a little bit about that. So I feel very fortunate that we have a health center that is close for all of the partners and to be providing the results that we're getting. So as I think was shared earlier, there are currently 4 partners. We're looking for one more for this particular health center, but Kevin, I think I'll just mention that ultimately, I think our bigger vision would be to see employers sort of band together and have several of these shared health centers across the area, because trying to go it alone, sometimes we just don't have the numbers or the finances behind that. So I know we've had conversations with several other folks about if another health center gets set up beyond ours, how do we work together? How do we share the knowledge? And maybe our employees, if they live closer or whatnot to each other, could utilize each other's space. So that's broader vision. Let me just say that for our health center, the work is done. So when we're looking for one more partner, we did all of the work to set it up. So now's the time for it to be easy. You just got to sign on and say, yes, we're going to do it. And Marathon Health is, I can't say enough good stuff about working with them. They are the leaders in this industry. They're a healthcare model. Well, Christina is our local nurse practitioner, and Angela is the med tech in the office. There are layers up through Marathon. So they're overseen by a physician. They have a medical director. So there's full oversight of the team. And just to give you an example, during COVID, we were going to open this health center in the midst of COVID in the pandemic. So we opened in July. So we had already said, yes, we were going to go. We were already into implementation when the pandemic hit. And so while that might be scary, it was actually a huge benefit for us. So anytime we had questions about COVID, the health center was our expert on our team for all of the partners as to how are we going to deal with testing? How are we going to deal with keeping our population safe, contact tracing? All of that was handled through Marathon Health. We set up the policy. They kept the eye on CDC. They kept the eye on what was going on with the state, what was going on with other partners or other health centers out across the country that they worked with. They brought all that expertise and gave us the recommendation of, here's how you should be dealing with your employees. They did everything from providing us on their app. We could go on and answer an assessment every single day for our employees when they were coming into the office. There was testing at the health center outside a couple of times a week. If you needed a COVID test, Christina was out there, took care of that. We got the results back. If there was a positive, she helped with that contact tracing within the team. So it was an extension of our team during that time. And I can't tell you, in the midst of trying to do all the other things that we do in running our organizations, that to have that expertise at the table was invaluable. So, so that was a huge win for us in bringing them on board. So let me speak a little bit to how we opened. So in July, we opened virtually because we couldn't all be together, and we thought that might be a hurdle. However, I will say that I have heard that folks have been able to get in and see Christina in some ways if they needed to. However, the health coaching component has been done mostly virtually. And that has worked for, I'll say even for myself, for those of us who are busy and you're able to just pop on, you got out of a meeting, you pop on, you spend your time with her, and then you pop off and you're right back into whatever you were doing. So it was actually a bonus that we've been able to add, and that will continue to be a part of what we have as an offering. But the health center opened in July, and we Marathon told us that if we did 3 Steps to Wellness, which was a program where our employees did a health risk assessment. So it was a questionnaire online talking about their health history and providing information. And then you went into the health center, as Barry said, to have your biometrics. They took blood, they weighed you, they measured you, those types of things. Then you go away and Christina reviews that information, and then you have this comprehensive health review. And she goes through the numbers, she asks you questions, you have very in-depth, as Barry said, those are like 90+ minutes long. And at the end of that, you have a wealth of information about your health that you may not have had previously. And Kevin, I'll just mention the funny part of, they tell you what age you are based on your health. And Kevin, I know you're close to retirement here, but you had an advanced age that was given to you.
I was 78. I'm 64 at the time, and they told me I had the body of a 78-year-old. So that kind of woke me up. Yeah.
So good information. And then our folks, Christina sets goals, and then there's a continual contact. So if somebody comes in and they do their biometrics, they have their comprehensive health review, but they don't start working on anything, then the health center reaches back out. So it's very much a development of a relationship, and how can I help you that happens. I will tell you, for our population, we incentivized the 3 steps that we went through, and that had great adoption. And so we've had 60+70% of our employees have done the 3 steps. And so we've incentivized that. Folks have appreciated that. And then I will tell you, what is important to us is the outcome on the other side. We wanted to talk about wellness for our employees. So of the population that we know has been through that sort of review, there was, I'm trying to think the number of people, I can't remember the percentage, who had high risk conditions. However, of those folks who had high risk conditions, 75% of them actually started engaging in health coaching. And of that group, another 75% has made strides in a positive direction, whether that's improving your cholesterol, losing weight, working on stopping smoking, whatever the goals may have been. So from our perspective, that's huge for the wellness of our population, which was one of the factors that Kevin mentioned is really important to us now. When we started out, it was all about the finances and doing the right thing. And now to see that and hear our employees talk about the changes that it's made in their life, that seems to be, I think for some of us, much more important. From a financial standpoint, I will tell you that we pay the same amount every month. behavioral health, we added a 20 hours a week behavioral health, mental health specialist who's there. We've used him in a variety of ways. It's not just one-on-one counseling, but we had a situation here with our employees that was, there was guns that went off in the mall and our libraries in the mall. And we had staff that were concerned about that. Happened on, say, a Tuesday, and within 48 hours, we heard about it, the next day that they were sort of worried about it. We got the Demir, who's the behavioral health specialist, on virtually with that team, and they walked through a process. And at the end of that, we only heard that that was fantastic. Folks got what they needed. So it's like having your own doctor, your own counselor on staff, that when something happens with your staff, you can use those resources, and it's not costing you anything additional, and you're not trying to schedule it in because they're sort of here as part of your team. And I will say Marathon has been very fabulous about flexing to meet our needs, whatever they may have been. They also do things like lunch and learn and all sorts of ways for us to work together. So I'm going to share with you guys a couple of stats. So in the last 9 months, 3/4 of the way through the year, our employees that have participated at the health center have had an average visit of 3.5 is the average visit. So you can see that this isn't the once a year go for a physical. Folks have been going in, and I know Christina has some who come in, every other week, or she talks to them on a regular basis for the coaching, as she indicated. I will say that all of our partners are at what the average is for what Marathon Health has across the country for their benchmark. So we're not even a year into, well, we're just about a year because we started in July. Now we're just about a year. I don't have the numbers yet, but we're already at the point of what they say where we should be for a long-term health center, and we're only into year 1. So I wanted to share that information. On the financial side, I will share that and reporting every month, I get a report about our health center. It shares de-identified information. It doesn't tell me individuals, but it aggregates the information. It tells me about the health of our population. What are the things that are the highest illnesses or the things that are being seen, so we can talk about education. How can Marathon Health use their resources to reach out to folks? How we can support that, our wellness committee or HR or the senior team. But when I look at the finances, they give us a report, and it tells us how much we saved by redirecting care to the health center versus going to the hospital or to a physician. And in the report that I'm looking at, I think this was 3/4 of the way into the year. We get hard numbers like that. That's redirected care. And then there's soft numbers. So if somebody were to be out sick, they got to take the whole day off because they got to go to the doctor, and then they got to go to the pharmacy and all of that. Whereas here, they could just pop into the health center during work, see Christina. We also have a dispensary. They could walk home with a prescription if it's, something that we carry. And so lost time is a whole lot less, is what we're seeing. And we were seeing savings over $120,000 out of both of those buckets. So, and we have great flexibility in how we run the health center. So when I talk about prescriptions, if there are certain things we want to carry in our dispensary because our employees are utilizing those, we're able to carry that particular pharmaceutical at a much lower rate than you can get at the pharmacies around, because Marathon Health has that buying power of buying across their entire population through all their health centers. So we participate in that, and I think the number is something like it's like 30% of the cost that you would pay if you're going to a pharmacy. So you can imagine if you don't feel well and you're gonna, whatever it is, you got a cold and you need to get an antibiotic, you go in, you see Christina, and you walk out with your little Z-Pack and off you go. And you don't have to figure out going to Hannaford's or wherever it may be. And it took you, an hour out of your day instead of try to get into the doctor, wait there, sit in the waiting room, go to the pharmacy. So, so I just mentioned that the experience is much more streamlined. Let me say, one of the things that we heard a lot when we were going to set up the health center was about what happens when you have a shared model. And we had a little bit of conversation before we started, before we hooked up with our partners. There was conversation, much like we're sitting in today, to say, well, how would that work? And whose place is it going to be closer to? And will my employees drive there if it's not closest to our site? I will tell you that your employees are getting in the car and going to the doctor anyway. And where our location is, it's easily located at Kennedy and Dorset. So we have found that it hasn't been an issue for any of the partners that we have. And I would imagine as more health centers come along, having several of them may make that beneficial as well. One of the
regarding that specific issue, Coralie, did you have employees concerned about where they lived and access rather than the office and access? And especially with COVID, did that come out, and was that eased as they got used to how this was working?
Interestingly, employees just started using the health center and they didn't really, there was no concern, because most of the time you're going to see the doctor, it's during the day. And so they're coming to work, or it was an easy thing for them. I will say that for us, our spouses and dependents are part of the health center, which is an option. It doesn't have to just be your employees, but it could be the whole family unit. And so we are seeing, we get numbers on that as well. So we can see how many of our spouses, dependents are using the health center. And Christina can treat anyone down to age 2, I believe, is where we are now. And we're seeing that. Remember, they're on your health plan. You're paying for those families. And so it's not just your employee, but it's whoever else is on the health plan. And so, and when we see progress there, you're going to see it financially and in the wellness of your population. And we also have folks who have a spouse who, employee might be healthy, but spouse has some issues. And that's where sometimes we see the costs are driven up with healthcare, right? Is that you got someone who has something. So for us to be able to have that as part of what we provide to our entire population has helped us immensely.
Great, thank you.
The other thing I will say about partners is that we get together, we get together quarterly, and we talk about what we're doing with our population, how the health center is running, what things we might want to do differently, what sort of education we need to provide. Are there things we're hearing from our employees that we need to process with Marathon? And in addition to that, it allows us to have conversations outside of just the health center, but what else are we doing about healthcare? And so while we're, into year 1 of our health center, we're also talking about other strategies that we're taking to build on that, to continue to have better control over our healthcare costs and to better educate our employees on where they can get care, what type of care they're getting, and that can be coordinated through the health center. So you can imagine if you need to have a test, you see Christina and they say, oh, you have, X, Y, or Z, you need to go have some testing, or you need to have a referral. She can manage all of that for the employee, help them get the appointment, do the blood draw if that needs to happen, to get it sent to the lab and then have the results go to the specialist. So that's been a benefit I know that the partners have spoken about. So I know I'm a few minutes early, Steve, but I don't know if you have questions you want to ping at us, or I'm happy to move along and give more questions at the end.
Yeah, we opened during COVID. The health center opened during the time of COVID. You mentioned a little bit. Do you believe that assisted in the increased utilization? It was a little bit easier for people. They could pop in via video, or once things opened up a little bit, they could be in. Did people feel that protected them more because there were less people going to this? It was almost like a private club health center. How are you feeling? What feedback are you hearing from the employees?
So I will say that I think if you recall, it was hard to access medical care in person during the start of the pandemic and through last year. And so having this resource where you could come, you could get your biometrics, you could find out what was going on with you, but you had this virtual component, you could start to develop this relationship with Christina. I think whether you see her in person or you are on the screen, you develop that rapport. And then I think that it was beneficial. I think that another part that was beneficial due to that was the fact that they were managing our COVID sort of medical plan. And so folks had to, if they failed the test or they had the sniffles and they needed to get checked out, all that ran through the health center. So while we were concerned about it opening during COVID, it actually, folks had to use the health center in order to come to work.
I have a question. Sorry. So it sounded like the mental health thing, I was unaware that was added until just a few days ago when we were chatting. Are there any plans to add additional services or team members?
Yeah, so right now, we have the behavioral health specialist. So Demir is here. He's part-time. As we add another partner and the need is there, our goal is to go to 40 hours a week because we think that could be filled by the population. And we hear across the Marathon Health network that once you add someone part-time, it doesn't take very long until they've got a full load. So we know we have that here at the city. We're interested in providing some physical therapy type aspect, and so we partner separately, or we hire that out separately, but we're interested in perhaps sharing that with the partnership, and is there space there or whatnot. So I think what's great is we can start to think about what services do we provide at the health center.
Does that occur at members meetings for the 4 organizations?
Pardon me, Barry?
You have member meetings with like Twin Craft VSAC to talk about these things?
Yes, so the partners do quarterly. We talk about it. We don't have anything for employees, but for the partners, we talk about that on a quarterly basis as to what we see coming forward, what's been happening, what would we like to do next. And so we're already moving forward, like I said, into pricing transparency. And if you have to have a procedure, what does that look like? And so there are some tools. And so we're moving forward with that. The city of South Burlington is, but we're bringing our partners along with us to say, hey, guess what? We're doing this. What do you all think? And they're shaking their heads. So, I think that there's some benefit in more than just 1 or 2 people in your organization trying to figure out what am I going to do about healthcare when there are a bunch of folks who might be doing different things. And as we're uncovering and getting the expertise and we're building that, it's nice to have, all those heads around the table to get the best experience.
And Kevin, I was interested to hear, you entered this process and the education part of this early on, obviously expect, how is this going to save me money? And at a certain point you switch to, how can I provide a better service and a healthier environment for my employees? Was there where did that switch flip? Was there a level of skepticism you had when you were okay, how are they going to save me money? What's this going to be like? And what was it that finally made you comfortable, like, yes, I'm bought in, this is it?
I think it's a good question, Steve. I think we always thought it was going to save us money. We were pretty confident of that. The shift really occurred early on when we started talking to some of our employees. Hey, we're going to introduce this issue, and we started to get some pretty positive, or this clinic. We started to get some pretty positive feedback. Now, employees really don't know that much about the difference between a traditional insurance company and a captive, but they do understand the difference of that, some of the differences that Barry talked about being able to go in on very short notice and spend quality time with a clinician. And so the shift to the health of our employees, the overall health of our employees happened pretty quickly. And it still remains strong. I'm the employer, I'm their boss, but you know, I want them to have a healthy life. They contribute a lot to the quality of life in this community, and I want them to be healthy and have a good quality of life too. So it happened pretty quickly.
Okay.
I would add to that, Steve, that, you know, we have uncovered, for example, Marathon has uncovered through working with employees that folks who have chronic conditions and haven't been to the doctor, that might be a time bomb, a ticking time bomb that, for example, if they're pre-diabetic and they can do the work now, it's going to cost us a whole lot less money now than it is down the road. So you're investing in, let's see if we can fix the root of the, you know, the situation, and before we get all those symptoms that are going to cost money, and then you're down the road and you're just trying to put a Band-Aid on it. And so I think that's a huge benefit that we didn't know. I mean, you don't know if people aren't going to the doctor, and again, we don't know that about specific people, but we're seeing those trends, and we're hearing that those things are being addressed.
And encouraging wellness visits and wellness programs, and we hear about that all the time. You now have insight to that. You've had the great percentage of the people that you said have gone through all 3 steps. You mentioned that you did incentives for that program. Can you just speak briefly about what that incentive was and what was the value to it for the employee? What level encourages them to get to the doctor this often? Yeah,
so for us, we have a long-term play in bringing down healthcare costs. For us, in I think 10 years, our healthcare costs doubled for what we were paying when we were self-insured. So when we look at this, and we know that we want to look at the health and doing the 3 steps, we knew that we wanted to do 2 things: incentivize people, but we also wanted to share savings with our employees. It wasn't just about saving us, the employer, the bottom line. If we saved money, we wanted our employees to be bought into that. And that, I think, helped. So one of those was the incentive. And if they had to do all 3 steps, which are pretty simple, and they got $75 in a Visa card, they could spend it however they wanted. We just, at the end of the quarter, anybody who had done it, they got their card, they spent it on whole variety of things that people did that with. Additionally, we're in a place where we're going to give a dividend back to our employees based on some savings that we've had, that we're pretty committed to annually. If we have savings, giving some of that back to the employees. So we're all in it together. But that's not something that the health center does. That's something that we're doing and talking about with our partners, and kind of walking the walk.
So the very early success gives you the flexibility to have that part of the program.
Agreed.
Yeah.
Mm-hmm. Yes.
And as you entered it and you were looking, it was all projections. Marathon is great. They do this all over the place. They've done it for a long time. They understand what this data is. They take a look out into where your employees live and access, and make assumptions on how this plan is going to be utilized. And to a certain point, there was a level of faith you had to have in those projections. I'd like to switch to Michael right now, because now that we're involved in this, we do have actual data, not just projections, on how things are moving and some of the successes that we can see. So, Stacy, I think we'll switch to the next slide, and we'll see if we need to maybe bring up the separate PDF. Michael, tell me how you're seeing that.
It's small, Steve, but I think it's okay. I can kind of walk through it. So, well, good afternoon, everybody. And this has been a wonderful day to listen to all these success stories, and really pleased that all of us at H&B could be a part of this. So my job today is essentially to walk through what numbers might look like. And I guess I would start this conversation by taking where Coralie sort of left off, which is that ticking time bomb, and what could that look like for your plan. And as most of you know, the large majority of your costs for your health insurance, whether you're fully insured or self-insured, are related to high cost claimants. And I think it's about 15% of your population drives about 85% of your costs. So when we start looking at these numbers for the health center here today, what you want to think about is what is the percentage of the cost for the health center compared to your overall premium, and all the benefits that Kevin and Coralie described for your employees, because this is really a new employee benefit, quite frankly, that you could get by entering into the center. So how does this work? Now, take this for what it's worth. This is an example. If someone were to join the South Burlington Summit Health Center, Employers Health Center today, what would it look like and what would it cost? It would be $55 per member per month, that PMPM you'll see at the top there. And the reason it's per member per month is because, as I think Barry mentioned, you can have not only your employees participate, but you could have their dependents as well. That's a choice that you as an organization would be making in terms of who you want covered underneath this. So if we do this and we say there's about 150 members in this particular sample organization, the year one cost at $55 per member per month would be that $99,000. So you're talking about $100K. Now, when you compare that to your percentage of premium, my guess is that for 150 employees, an organization is probably spending somewhere between $1.5 and $2 million on your healthcare costs. So about 10% of that, you're going to be able to have all your employees go to a health center now and get that experience that Coralie and Kevin and Barry described. So from an outset, before we even get to the ROI, I mean, you can start thinking about how this could actually change things, because if your employees are healthier, they're happier, they view this as a benefit. Coralie and Kevin did a great job describing it, how that sort of changed a little bit the culture of their organization, because this is seen as such a benefit. So you can just start there. But if we want to start talking about ROI, and Stacy, maybe you can just kind of scroll down just a little bit if it's possible. So you're going to see here, there's a couple of things that are listed here. We've got redirected care, we've got utilization reduction. It's kind of the things that Coralie talked about already, where if we're avoiding care, what does that mean? Because we're already paying for the health center, as Christina mentioned at the outset. So if we're paying for the center, we're obviously avoiding some of those $150 charges that Barry was describing in his section. So Marathon, based on their data and their algorithms, comes up with a pro forma where it basically tells us what the ROI will be in year one, year two, and year three. And as Coralie mentioned, they break it down into hard savings and then soft savings. And the first hard ROI, as you see that red box down there at the bottom, that's the hard ROI. They're projecting for this particular group in the first year, they're going to come up with an ROI of 0.7. So they're almost getting all their money back in the first year by doing this. Second year, they're at the break even. And at the third year, they're at 1.3. And if we extrapolated that out, those numbers would actually get bigger based on Marathon's book of business. But overall, over the 3 years, you're basically break even from just the cost of the health center. That doesn't get into, well, how much care did we avoid by having people be treated well and have a good experience and know what their health is. So there's that piece. But if we include the soft savings, and gets a little bit squishier, and Stace, if you scroll down just a little bit further, please. The soft savings are basically the presenteeism and the fact that they don't have to go see a doctor somewhere far away. So in this example, again, now we're saying between hard and soft savings, we're looking at a return on investment of 1. Year two is 1.5 and year three is 2.1. And I think the overall, if I remember right, Stacy, you can scroll right there, is 1.5. So this to me, we've had these conversations with employers for a long time, and so happy to see it come to fruition. And we're about a year in now, and happy to say that these savings that we're seeing, as Coralie mentioned, are actually real. And beyond that, it's also providing a better member experience. And getting back to Kevin's point earlier, we've, I call it the fed up continuum. Kevin used a better quote, but the fed up continuum is for employers who, where are they on that fed up continuum? Because they're not getting the dollar they're spending, they're not getting the value out of it. Neither are the employees, who are also contributing to the cost of health insurance premiums. So there is a different and better way And this is one part of it. And this is a big step. And I think that we're seeing already through the experiences of the partners that this is something that is working and is having an effect. And not only is it reducing costs, which Kevin mentioned at the outset, that was kind of getting into it, but people are becoming more well. And for the city, you know, it's a triple win perspective in my view. It's like, it's a win for the organization because costs are down. It's a win for the employees because they're getting better care and are more well. And then it's a win for the taxpayers who are the stakeholders for the community because they're not having tax increases based on these incredible healthcare cost increases every year. So we're at the infancy of this, but we're already seeing great results. And I would just mention, kind of piggybacking on what Coralie said, is that there's an opportunity, in my view, for employers to really band together and do things like the health center. But beyond that, they can do things like direct contracting with providers. We're sort of, as employers, we're on our own little island, if you will, trying to sort of hold our costs on as best we can. But boy, could you imagine if we got together, sort of had our critical mass, that now we have leverage and we have all this great brain trust together coming up with solutions and different ways to approach things. This health center is just one example. I think this is sort of the tipping point for what's going to happen here in our state going forward. So I think hopefully, Steve, that kind of covers the numbers and a little bit maybe to the future as well.
That's fantastic. Thank you, Michael. And the key today, and I hope you found the value in this that we wanted to convey, and this has now gone from the concept of the projection that Michael just walked through and what this might be to reality. The clinic is now up and running. We have experience through it. Coralie mentioned that very early on, inside of the first year, they're beyond the first year expectation for return on investment. This is no longer, let's have faith, let's change the philosophy and go with a concept. This is reality, and now we have the stories that come out of it. And what we hear about this health center now is that it's not just a freestanding building for someone to go get their sore throat. Marathon is behind this. They provide a great breadth of expertise. They have great purchasing power. This becomes more than just let's have a wellness visit or a sore throat. Mental health can be added to this. There are limited prescription drugs that can come out of this, helping to save time and provide convenience to employees. If you choose, you can open this up for the dependents. It's not just your employees that get this coverage. And again, this is all now anecdotal, real life experience that you're hearing about, not just, hey, this could be great, and have faith in these numbers that go through there. And this health center right now is up and running. And as you've heard, if you've found the interest in this and the importance of what one of these can do, we encourage you to continue to look at this. Please raise your hand if you're interested in joining. And if you're not immediately in the South Burlington area for this clinic, as we said, opening clinics that could then make a web of clinics and give us more leverage in the market. Michael ended with, hey, we could directly negotiate with some other providers and do some interesting things to help control cost further and take control of the risk that we have and provide these great benefits for our employees. Please raise your hand. As we end this, Stacy will send out a survey later asking for your feedback. We value your feedback in how the presentation went and what value you got out of it. But at the end of that survey, we'll also give you an opportunity to fill out to ask if you want somebody to reach out and talk to you, and we can help shepherd you through this to join this one or to create a new one. We now have the roadmap, understand how to build these, and we'd look forward to making this something bigger and taking control. And with that, I'll open it up to some questions, if there are any additional. Okay. If anyone's trying You are on mute.
The
Do
question
employees
is-
have concerns about confidentiality? Coralie, I
Maybe-
think I'll ask you that.
Actually, I was going to jump in on that one if it's okay, Coralie, because
Oh, yeah,
this
go
is
ahead.
this is something that we were concerned about initially because it could be seen as the employer's clinic. And I think what we experienced as we worked with Marathon is that, first of all, there is indeed a firewall between the data that Marathon gets and then what the city gets. So, we were confident of that, but Marathon also does a really, really good job about talking through how this could happen. And then I will say it comes down to communication with employees to assure them that we won't get any individual data. This is not, we are not, as Kevin mentioned, we are not staffing this clinic. We have people from Marathon Health that are doing this. That is their job. So that firewall is indeed in place. And I think that alleviated some concerns. And then as people started using the clinic, they started realizing that, hey, this is something separate than from the city. It's just sponsored by the city and the partners.
Thank you. Any
Let me
further
just-
questions?
Let me just add,
go ahead.
in addition, one of the things that I was concerned about was how do we encourage folks to go to the health center? It's like one more job to now sell them on the health center. And I will tell you that Marathon Health does that, and they do that really well, and they have a system. So that was one less thing. They actually send us, they speak directly out to the employees, but then they send us materials that we add into our e-newsletter and that we share and posters we put up. So that's nice that we don't have to figure all of that out.
So another question comes through. How many total employees dependents make up the base of the 4 members currently? Further, are prescriptions and lab work that happen at the clinic submitted to insurance?
Michael, do you want to help me with that one?
I sure can. Yeah. So right now, I want to say that the last number was like 689 members are part of the clinic itself. And then when it comes to the prescriptions, the answer is no, they don't get run through insurance. They're actually charged through the clinic. But as Coralie mentioned, it's about 30% of what the cost was. Now, recognize too that, if there are very specialized prescriptions, that's not something you're going to be picking up at the health center. But for sort of generic prescriptions that are very common, and as Coralie mentioned, if there are some that we see that we need to add because a lot of people are using them, we could put them in the clinic. But those are actually charged as part of the clinic cost. So you would have your admin fee and then your prescription cost on top of that.
Great, thank you. How big of an employer do you have to be for this model to work? We're all chomping at the bit.
Yes.
Go ahead, Michael. Why don't you go ahead, Michael.
So if you were to be your own employer, it depends on how much you want to spend, quite frankly. But to make the numbers work from an ROI perspective, what we've heard Marathon tell us is that it really needs to be about at least 800 employees. But if you're joining a partnership model like we're talking about here, then you could be basically any size, because the more that you add into that pool, if we get to a certain number, theoretically, we could actually reduce the cost for the partners as well. So, and I think one of the things that maybe Steve mentioned at the outset with the funding arrangement, if you're fully insured right now, it may be a tough kind of pill to swallow to say, I'm going to spend $100K if I'm 150 employees to add a clinic, plus I'm paying my fully insured premium. It probably makes the most sense from a self-insurance standpoint. That's not to say it doesn't from a fully insured standpoint, because you could actually reduce claims and therefore your renewal would be lower, but it probably makes that. So I would say, if you're 70 employees or more, this could be a model that could work for you.
Great. Thank you for the questions. That's great. Any others before we close? Well, I'd like to thank everybody for showing up. This has been fantastic, and hearing about this and making it something real, I hope has been very useful for all of you and provided good information. And we look forward to hearing from you, and keep an eye out for the survey that comes probably tomorrow. Thank you.
Everyone.
Ready?
Thanks.
Doodles.